speech.
This is a demonstration speech on the admission of a newborn baby. There is a whole lot more to bringing a baby into the world than just making a great catch. It is not in my job description to make those great catches, but I have a lot to do with a newborn admission and the assessment and care of a newborn. I do a very complete and thorough assessment of a newborn after birth, and I have been doing so for several years. Once a newborn makes a transition from intrauterine to extrauterine life, the most important thing is determining the stability of the baby immediately after birth. A thorough assessment is completed and feeding initiated, all the while instructing the parents and caretakers of the newborn on proper care. There are several tools that we utilize in the admission of a newborn. Gloves are essential because babies come out pretty grubby with a lot of bodily fluids. And for their protection and our protection, we utilize gloves, towels and blankets to remove the fluids and keep the babies warm, as well as a hat and clothing. We use a tape measure to get some of the measurements, stethoscope to listen to internal organs and evaluate their health, a thermometer, of course, for taking temperature, and a bulb syringe, which is very important in clearing out the secretions that the babies are usually born with and that they can get choked up on. So once all the equipment is gathered, the evaluation process begins. Like I said earlier, stability is determined, and we use a process called ABCs, where we evaluate breathing, the airway initially, breathing, and then circulation. The airway needs to be patent, and we use the bulb syringe to help us with that, and proper positioning of the baby for optimal airflow. Breathing is determined by just mainly looking at the infant's effort that they're putting into breathing. And then circulation, we evaluate the heart rate and the color of the baby, which tells us whether the circulation is appropriate or not. Now, as we are doing this, we are undergoing an APGAR scoring system, which gives the baby a score for those 3 ABCs that I just mentioned. At 1 minute and 5 minutes of age, the baby receives a score, and it is assigned to the baby at birth. It may or may not mean anything, because a lot of times if they have a low APGAR, they can transition out well and not have any issues later. While we're doing this as well, we get measurements. Everyone wants to know how much the baby weighs and how long it is, so we obtain the measurements with the instruments that we have. So once we know that the baby is stable and breathing well on his own and whatnot, we continue on with a more thorough head-to-toe assessment. The assessment we do determines maturity and can pick up any physical characteristics or possible problems that the baby may incur. So we have a Dubowitz and a Ballard score system that we utilize, and this is a number assigned to the baby that gives us a evaluation of the baby's gestational age, because sometimes our dates are wrong when we have a pregnant mom. And the Dubowitz evaluates neuromuscular maturity and physical maturity by looking at certain characteristics and assigning a number. Along with this and following this, we complete the head-to-toe assessment. And the head-to-toe assessment is just what it says. We look at the baby from head to toe. And while we are completing this, we oftentimes are communicating with the parents on the proper and sufficient care of their newborn. Those instructions involve safety and security. The bulb syringe I mentioned, we teach the parents how to utilize that in case the baby gets choked up. Babies are supposed to be sleeping on their back to avoid suffocation, and their breathing is most efficient when they're on their back. So we instruct the parents on that. We also instruct them on security guidelines that we follow within the hospital. And those involve the ID band that the baby has that matches with the parents, and the ID badges that we wear, which enable us to pick up their baby. So we see that immediately after the baby was born, we did the brief initial assessment to determine the baby's well-being, and we followed with a little more in-depth assessment of measurements and Dubowitz and Ballard, and then we follow with feeding initiation and instructing the parents on frequency of feedings, amounts that the babies need to eat, and making sure that the babies get fed. The in-depth assessment that we do also helps us to pick up any problems or possible anomalies that may require some advanced observation and treatment for the newborn. So there's a lot that goes on within the first few minutes of life. And I'm going to quote StanfordChildren's.org when they say, "A complete physical examination is an important part of newborn care. Each body system is carefully examined for signs of health and normal functions. And thankfully, more often than not, the newborns that I see are healthy and have normally functioning systems. But if not, many problems can be detected with a thorough and conscientious assessment shortly after birth." Thank you.
That was awesome.
We loved it.
Yeah.
Do I need to show me?
No, he'll know you.